Doctors and researchers are still in the dark as to what exactly causes fibromyalgia, but most likely several factors are involved in its development. Physical or emotional traumas such as accidents, major surgeries, post-traumatic stress disorder, and emotional stress can trigger fibromyalgia. Other conditions such as infections and sleep disorders can lead to the condition. And abnormal sensory processing in the brain may cause increased pain sensations. This last factor is being studied further and is thought to come from what's called central sensitization. The theory is that repeated nerve stimulation over time changes the brain chemistry of a person who develops fibromyalgia. In a case of central sensitization, the amount of chemicals that signal pain may increase in the brain of the patient, resulting in an overreaction to low levels of pain. So, for example, a simple pat on the back may register as a painful pound to someone with fibromyalgia. So, who is most likely to develop the varied symptoms of fibromyalgia? The number one risk factor for the condition is gender. It's estimated that 3 to 5% of Americans suffer from fibromyalgia, and 75 to 90% are female. Most of these women began showing signs of fibromyalgia in their childbearing years. Now, besides gender, other risk factors include age. While it can be diagnosed at any age, studies have shown that seniors have a higher incidence of the condition. Genetics. People who have family members with fibromyalgia have a greater chance of developing the condition themselves. It also often co-occurs with rheumatic conditions like rheumatoid arthritis, lupus, and ankylosing spondylitis. The causes and risk factors for fibromyalgia aren't as clearly defined as they are for most conditions and diseases. But if you or someone you know is experiencing some of the symptoms we've talked about, it may be time to see a doctor about a diagnosis, or at least to rule out other potential problems.